So I think, first of all, we need to do a better job with the well child visits for kids. Right now, I have templates that show that we need to talk about gender identity at age 3, and then sexual education from ages 4 through 11, and that's it essentially. And that's all it says in these little checkbox algorithms. I think that we all need to be talking about the normalization and teaching about the acceptance and the existence of LGBTQ people early on in developmentally appropriate manner. So I'm not talking about acts of sex with young children. Absolutely not. What I'm talking about is within the cultural context. For instance, Disney. We could talk about a Disney prince having a same-sex partner, or a Disney prince is not really a prince, but actually a princess, and understanding that sex at birth does not always correspond to gender, but that everyone needs to be accepted. So us as healthcare providers, we should be providing that information to parents on how to educate their children about that, because ultimately, although children many times just grow up to be straight, they still need to be able to support LGBTQ people in the community. Right now, LGBTQ people in schools are getting bullied. 9 out of 10 students that are LGBTQ in K through 12 have identified that they feel like they've been bullied at some point in their life. 67% of LGBTQ teens have said that they have heard a family member say something negative about LGBTQ people, and only 5% of students say that they feel that all of their teachers and staff at school are supportive. So I think that we need to normalize this for everybody in all of society at a much earlier age.